I'm Jerry Banks. I'm a chiropractor, and I got into chiropractic because it helped me in my life to be able to play, to be able to work, to be able to do things that I enjoyed doing, and to stay healthier at a higher level. What I've found throughout my career is that um, lower back pain is one of the most common reasons for people to see any type of doctor. It's a very common problem. 80% of people will have back problems at some point in their life. And 85% of back pain is labeled as non-specific low back pain, meaning that you can't really see the reason for it on imaging. There's not an obvious muscle, bone, or disc that's significantly damaged. And a lot of that non-specific back pain is preventable. And so I like to share some of the exercises and movements that have helped me personally and have helped my patients to recover from back issues, but also to prevent them from being an ongoing, recurring issue. And so before we jump into the presentation, I want you to think about presentations that you've been into in the past, that you've maybe received really great content and had the best of intentions to follow through and practice the things that you learned. But when real life hit and other pressing demands were upon you, maybe you didn't really apply or implement the things that you learned. So if you can relate, raise your hand. I know that's been the case for me as well. So I've created a fun little way for us to practice the things that we talk about today in the days moving forward. So I'll show you how that works at the end. So just a fun, free opportunity for that. So my personal experience with lower back pain is that I have small kids and I'm their jungle gym. They love to jump on me. They love for me to throw them up in the air. And I remember one case in particular. I was down on the floor wrestling with the kids, and my 8-year-old, who doesn't recognize the effect of her growing size compared to when she was smaller, jumped on my back in a way that I felt an immediate pull or strain in my lower back. And I had a tweak like this before that made me feel like an old man. I was hunched over, and it took several days for me to be able to recover from it. I remember it was a chore just to put on my socks and shoes. Who can relate to being in that kind of predicament with your lower back? Well, thankfully in this instance, once the dust settled, I was able to kind of work through it, and it wasn't an ongoing debilitating issue. And I attributed that to the things that I do to protect my back, to keep it strong, to keep it healthy. And so we'll talk about a few of those things today. So this presentation that I'm going to share with you, I normally do in 40 minutes. So I'm going to fly through the first part of it and then get into the meat and potatoes of what you can do. Is that fair enough? Good. So objectives, get through, where low back pain issues come from, the impact they have, what you can do to prevent it. When you have back issues, you may have tight muscles, stiffness, you may have pain into your legs, swelling, burning, or numbness. This can come from the discs in between the joints. It can come from the joint capitals. It can come from the nerves that are in between the vertebrae. If your disc bulges, it can put pressure on that nerve and it can cause a severe pain in the back or down the leg. The biggest nerve coming into your leg is the sciatic nerve. So some of you may have experienced the joys of sciatica, burning or shooting pain down the leg. On X-ray, the spinal column should be in alignment. The vertebrae should be in alignment with each other. Sometimes there can be a shift in that alignment or a bulge putting pressure in. And the impact of this is huge. I mean, it's $1 billion in the US, direct cost of medical treatment, drugs, surgeries, time off of work. And there are different ways to treat low back pain. Unfortunately, there was way too much on the side of opioid pain medicine prescription that has caused its own range of problems. You guys working with the Department of Veterans Affairs, are, I'm sure, very familiar with this opioid epidemic issue. Way too common. 40 people are dying a day from narcotic prescription overdose, and that can lead into other other illicit drug use, unfortunately, because of the addiction. Other medical options, surgery has its own pros and cons. There are a lot of these low back surgeries have not been successful at freeing people from lower back pain, and so it's important to ask good questions about the risks, the costs. What are the outcomes down the road? Most people are satisfied with physical therapy, chiropractic type of treatments just as much as prescription medications, and just as much as surgeries. So you want to look at your lower back health beyond just the symptoms that you're experiencing, because symptoms are just the tip of the iceberg. And only 10% of your nerves are even detecting pain. So again, I'm just going to jump through some of this initial stuff. You can have injury traumas to your back. You can have micro traumas, which is kind of repeated overuse or posture issues. A lot of this comes from sitting too much. It's having a huge impact on that non-specific low back pain being an ongoing problem. And chiropractor is going to help detect if there's a subluxation type of issue going on that can be causing that. So a few things to stop doing, to do less, and a few things to start doing. One thing to stop doing is to stop picking things up from a bent back, even if it's just a pen off the floor. I can't tell you how many people come into the clinic unable to walk due to back pain because they just picked up a sock. You want to make sure that you have a straight spine anytime you're picking something up. Age is just a number until your back goes out picking up a sock. Isn't that the truth, right? I've been there. Now, there can be an imbalance in the muscles in the lower back where you're overly tight in the back and the hip flexors, weak in the abdominals and the glutes. This can come from sitting too much. That's the most common reason for this postural disorder. And so let's get into some exercises that are going to help you create some resilience so you're not so vulnerable in your lower back. One of the main ones is to do squats. Squats are going to activate your glutes that are shut down all day long when you're sitting all the time. They're a great exercise for that. As a disclaimer, don't do any of these exercises if you've been told not to by your doctor or if you have a condition, but consult with a physician or chiropractor like me if you or have any questions about these types of movements. A deadlift can be a great strengthening exercise for the back and the glutes and the hamstrings, but it can also be a way to injure your back if you don't use the proper technique. So this is an important one to consult with a trainer or a therapist or chiropractor that's familiar with this type of technique to make sure that you're doing it right. A glute bridge is a very safe exercise to engage the glutes and train them up. And you can practice engaging your core while you do the glute bridge as well. Sit-ups we found are not the best exercise for your back or for your core. A lot of times when people think about strengthening their core, they think sit-ups is the first thing that comes to mind, especially if you served in the military. There were a lot of sit-ups, but there's a lot of wear on the discs from doing sit-ups, a lot of compression on the spine. So better are to do ab crunches, planks, front planks, and side planks. These are great exercises to engage your core, and your core is going to protect your back. An exercise that helps coordinating movement around the spine and engaging the core is a bird dog exercise. You move very slowly through this, breathing with an engaged core. And mostly, a lot of us know things we could or should do to protect our back. But again, life is just unnaturally stressful. There are way too many demands on our time. And so we procrastinate. And procrastination is the thief of health. It's really what takes our opportunities from us. And so we really have to schedule our priorities, the things that are important but not urgent, to get them done. And so I've created a fun little way, if you'd like to join me for a way to practice these exercises. It's 5 days of daily exercises for your back. And so I'm running a challenge this week. Currently, we're on day 4. But if you text the word challenge to 360-227-6522, you can opt in and I'll reset the timing so that you can start with day 1 and work through those 5 days of exercises. So again, this is a free opportunity to just practice some of these exercises and to get a little bit more detail on the how and the why of these exercises to really make your back resilient and strong, so you don't have to worry about playing with your kids or your grandkids or using your back in your work or in your fitness. You can move with a lot more confidence. So with that, it's also important to get your spinal alignment checked, and chiropractor is a great way to assess the health of your back and to keep it healthy, because if any of those joints are not moving or aligned the way they're meant to, that's going to create problems and accelerate the aging and degeneration process. So share this information with those that you think it'll be helpful, and I'll take any questions if you guys have any to ask.
Just a quick question with regards to posture. If you've got bad posture and you've had bad posture for a period of time, are those posture corrector kind of months any help, or kind of train your body to?
Could you type your question, Bernice? I couldn't hear all of it. I know it's a question about posture. I caught that much. But if you type your question in the chat, I'll be happy to address it. Anything from you, Lori or Heather? Thank you for joining. Any questions or clarification?
Hi, Jaron. I just put a quick question in the chat related to your practice.
Let's see. I'm pulling it up now, looking for a TMJ massage therapist. I believe one of our therapists does do intraoral massage. I also do assessments and treatments for the TMJ because that's an issue that I've struggled with myself. So there are a number of different body work things that we can do for that. So
excellent. And
yeah.
Do you guys take Kaiser?
We are not in network with Kaiser.
All right.
So yeah, your options are limited in the Kaiser network. It is a closed network, and so we're not able to join in, unfortunately. But we have a lot of Kaiser people. Well, there is one Kaiser plan that's called, I believe, Options, that allows you to go out of network, so we can do that. But we also have other people that just pay out of pocket because the rate really isn't that much more than the copay at the end of the day for most of them.
Thank you.
Yeah. Are the posture corrector harnesses a gimmick, or are they helpful to train your body to have better posture? Posture harnesses are helpful. They assist you, but they don't do all of the work for you. And so there are some that are better than others. There's one that I like called IntelliSkin, and it's a compression shirt with elastic fabrics that assist you in having better posture. But yeah, I haven't used the other posture harnesses, but I think they are helpful because they are going to train you to hold that posture. You wouldn't want to wear them all the time, but they can be a good assist. I'm sorry to hear, Lori, about the concern that you have there, and so if you're interested in talking more about that, I'm happy to do a consultation with you. Just reach out to Russell Chiropractic Center if you'd like. Thank you all for joining in. If you have any other questions, throw them in the chat. Otherwise, I'll just wish you that a good day and good conference.